Thank you for joining me, Dr. Amir, here at Fortis Health for another insightful session on the topic of testosterone replacement therapy. What about, can lifestyle and exercise actually increase one's natural testosterone levels? So yes, we do know that there's certain foods that can help promote one's endogenous or internal testosterone levels. So a good example is D-aspartic acid. It's been talked about quite a bit. It actually works by promoting luteinizing hormone, which is the hormone that comes from this fella here, from your pituitary gland that sits in this little they call it the Turkish saddle or the Turkish salica, which is just here. And that gland is, on another occasion, we have a lengthy talk about all the hormones that come from there. But that particular gland produces two of the hormones, LH and FSH. LH being luteinizing hormone, which actually responds, or should I say, sends messages to the testes to produce testosterone. And D-aspartic acid has been shown in studies to actually increase that. There's other food substances, things like tonjak ali, ashwagandha, things like fenugreek. Again, they have their own mild endogenous testosterone boosting effects, but we have to also look at the risks that can come with these drugs as well. Some patients have gastrointestinal symptoms with them. Some patients actually have had, in one case I've actually read about on a paper, where they've had renal as well as liver impairment, because it also comes back to these are food supplements. We'll be very careful. They're not medicines, and a lot of the food supplement world is not. Of course, there is the Food and Drugs Administration or the FDA that manages certain food supplements, but to be fair, a lot of foods can actually be put in supplement form, sold at certain shops, and wouldn't really be regulated. So we've got to be awfully careful with those as well. In terms of exercising, absolutely, we know that activation of the posterior chamber, so the glutes, the soleus, the gastrocnemius, and the biceps femoris, so all of the back muscles from the butt all the way down to the heels. If you were to constantly activate them through things like RDLs, Romanian deadlifts, Bulgarian split squat, deadlifts and squats. I mean, I'm not too keen on the latter two because of all of the problems you get with your lower back, but generally, or good mornings, again, carefully supported maneuvers can actually increase one's testosterone gradually, and we know this is going to happen as well. As well as things like intermittent fasting and managing one's fat, as well as one's lifestyle. Interesting enough, there are things that can actually potentially block your testosterone, and a good example is phytoestrogens. Where do we find those? We've actually had one study ourselves, seen ourselves live, and we've actually read about it online as well, where people actually are encouraged to eat one type of food regularly, what's called the soya bean, or the soya effect. Yeah. And this effect is quite pronounced. So in this particular food, there's one particular patient, and they were just living on soya. They wanted to be, champions of this vegan lifestyle, which is fine within reason. But they ate everything and anything as long as it was soya based. So they basically pushed their own estrogen levels up so high that what we don't realize, that estrogen, like testosterone, has a negative feedback mechanism on the brain. Because it will tell the brain, I've got enough estrogen. Again, you're taking external doses of estrogen, so not internal doses. And then the brain, the pituitary gland, we spoke about earlier, will reduce the productivity of LH and FSH, which will do two things. Will reduce testosterone production and also induce infertility. So the way that actually you manage this patient, really, not by giving testosterone, stop their soya-based diet. And then through time, you see that their levels actually start changing. The test starts coming up, estrogen starts coming down, LH-FSH starts firing off again. So there are also many principal ways where you can actually induce testosterone deficiency accidentally through diet. Okay. There's other things that can happen. Testosterone levels can fall through interim illnesses, testicular torsion, testicular injuries. Interesting enough, certain drugs that you can take regularly. So patients who are prescribed regular opioids, so cocodamol, codidromol, dihydrocodeine, morphine, any of these analogs that we use for painkillers on a regular basis, have actually been implicated in testosterone deficiency. And finally, head injuries, constant beats to the head. Did you know that boxers and wrestlers and the like thereof, and rugby players in their early 30s actually start developing testosterone deficiency? And you might see a lot of boxers suddenly in their 30s get quite trunkily obese, lose their shoulder mass, look a bit more lethargic, and they haven't recognized actually they can becoming testosterone deficient because multiple strikes to the head will affect the pituitary stalk, which sits literally behind the head, the eyebrow, and constant pounding to the head in that fashion can lead to reduction of LH-FSH productivity, as a consequence cause testosterone deficiency. So we know that head injuries, classic multiple head injuries actually can lead to that as well. So there's all these kind of confounding factors that can actually not only cause an increase in testosterone in some cases, but in a lot more cases can actually cause a decline or depreciation of testosterone. So let's take all of these into consideration when you're actually counseling patients.